Hands up on your chest a little bit more and out. Let's do that. A little bit more.
Oh my God. I really can't work out like I used to. I can't stand for maybe like 15 minutes at a time.
Oh, wow.
Walking is a bit tough for me. I always have to, you know, arrange myself in my sleeping.
Oh, wow.
Yeah. Almost literally every day. I literally have a headache right now. Oh. Oh my God. He's really strong. And the last chiropractor tried to do that, literally, and he couldn't do it. Lower back was really, really tense. Don't feel that anymore at all. I really appreciate it, for real.
Man, it seems like everything's just kind of hurting on you. Tell me what's going on.
Initially, I had a shoulder injury like a couple of years back, I want to say like 2017. Just training, I was on the ab roller and I was at full extension. And as I was coming back up, I felt a pop in my left shoulder. So went and got x-rays, got it looked at, and they initially was like, oh, it's nothing wrong. You just need to do physical therapy, you know, work on it. A couple of months later, I felt better. I was training with one of my good friends who was on the press. As I'm doing the press, I'm about to rack it back and he wasn't paying attention.
Oh no.
And I released, you know, the tension from my shoulder and it kind of snapped me back.
Oh shoot.
So I still had like issues from that and it just lingered on and on.
Did you get an MRI on that one?
I got an MRI. However, I never got the results from my MRI. So I still have the disc from my MRI, but
What?
right. The doctor was just like, well, we don't see anything, you know, egregious on your x-ray. We don't, you know, think that you have a torn rotator cuff because you're not complaining about issues that would, you know, arise from a rotator cuff. So it was just like, you know, just keep, you know, doing these exercises. So they gave me like multiple exercises to do and then, you know, I'm still having those issues.
Okay.
Lower back, that's been for some years. I had 2 ACL reconstructive surgeries like back in 2010. And after those surgeries, I started to have, you know, like lower back problems.
For sure.
When I initially tore my right ACL playing basketball, I grabbed my knee and I literally landed right on my tailbone.
Oh geez.
Yeah, so
it's been just a little bit of everything.
A little bit of everything,
Yeah.
like just throughout the years, and for the most part, I was told that a lot of it has been like compensation that I've been having from my knee injuries. So
Gotcha.
yeah, so knee injuries, lower back, and you know this shoulder's been giving me problems for years.
Yeah. How do you feel like it's been impacting your life?
Well, I really can't work out like I used to. Bending, squatting, just day to day, you know, me wanting to go places and do things I can't stand for maybe like 15 minutes at a time.
Oh, wow.
Walking is a bit tough for me. Just resting, laying down, sleeping sometimes. I always have to, you know, arrange myself in my sleeping.
So it looks like it's like really impacting your life a lot.
Yeah, just about every day, every single day, but you know.
And you're younger too. I mean, we're about a year off in age, so you're what, 38 now?
38.
Yeah. I mean, your whole spine kind of looks twisted, and from what the x-rays do look like from here, it could be a combination of like everything that you were saying.
Yeah.
But why come see me? Just curious. I mean, why come like 2,000 something miles?
I've been watching your videos since like a little bit before COVID. Like I said, when you were initially in Houston.
Yeah.
And everybody.
I was in a closet at that time.
everybody would say the same thing. Everybody, you know, just looking at the reactions from individuals who would come in here and just reading the reviews. I was supposed to come see you sooner, when you were in Houston. I was trying to actually book an appointment, but I kind of prolonged it, and then I started seeing your schedule get booked up real heavy. So I was just like, okay, well, I can hold off. But since everybody's saying the same thing, and I've been going to multiple chiropractors like throughout the years and still haven't really got that relief, I was just like,
yeah,
might as well.
I get you, man. Well, I'm glad that you're here. Anytime somebody comes from wherever, honestly, like it doesn't have to be from Florida, but even if you're like 15 minutes from here, I still appreciate it. We're gonna treat your body with respect and honor and make sure that you're getting some relief here out of today, right? Yeah, you're just twisted, man. That's kind of what it is. And it's like, you're kind of like ringed in a weird way. So like there's a lot of cord tension that's happening with your spine, like it's kind of shifted and molded in a different way. And it's kind of what's making your body just not feel so good all the time. So we want to remove the different areas that are locked, different areas that need some help so that you can feel better as well. As we start to go through the adjustments and stuff like that, I am going to be showing you certain things of your spine that are really concerning in my end. This is your lower back, right side. This is your left side. One, you see how like this width of this ilium here is a lot less than this thing there? Yeah. What this means is that you have a lot of external rotation that's happening like this. So your hip's out a lot this way. This one's in this way. And then your sacrum's also turned like, so basically if this was here, this is your body, this is the back, you're twisted like this, okay? Now the thing is, when it twists this way, normally this spine should twist with it. But it's not, it's twisting against it. So this thing twists like this, and then this part twists like that. So you think about if it's a towel, like you're just wringing that towel, especially right into that lower back. And that's probably why you're having a lot of that pain. And then it continues on upwards here where it starts to move this way and then it straightens out. But then as we start to go through that neck area, it starts to shift and deviate like this. And then the same thing here where your neck is just so straight. Even this is you looking up, dude, and you got no curve. Right? So in reality, I think a big reason why you're feeling all the stuff that you're going through is really like predominantly the stiffness in that neck, and then how that lower back has just ringed itself out. This is like your base, right? So your spine, your skeleton is suspended in your muscular system. But if this is like twisted one way, there's also like meningeal tension that happens. There's a lot of things that are just like, your body doesn't want all that. It wants harmony. It wants something to be nice, as even as possible, right? But the thing is, when your body's like that and it's stuck at that lower part of your body, it's gonna get just twist the rest of that spine as well too. Just think of it as like a spider web, right? If that spider web is pulled in one area, and what we're trying to do is undo the clumps, basically. Undo the clumps down here so that the rest of that spine can feel better. Let's have you look straight there for me, and then slowly look to the right. Stop before you have to force it, okay? Oh yeah, that's not good. So nose is about like 45. We'd like you to see Alicia, right? But you can't really see her, huh?
No.
Okay. look to the left.
All right.
Yeah, that sucks too. So you're like 40-ish this way. Which side's harder for you to go to?
So it's harder for me to go to this side because as I'm looking this way, I can feel it like down my neck and down to my shoulder and like on that right side also. Got it.
So look straight. Headaches, migraines too?
Yes.
How often?
Almost literally every day. I literally have a headache right now, and it's like from like
all the way down to your eye?
Yeah.
All right. Great, huh? I'm sure you love that. When did you start noticing things go for, like, take a turn for the worse?
Normally when I'm not like stretching, because normally a lot of times I'm a self cracker, so I'll just adjust my neck, and like normally when I adjust it, it'll relieve itself. But when I go for a long period of time without adjusting it, then I'm super stiff.
How many chiropractors have you seen?
I want to say maybe about 10.
That's a lot.
Yeah. It's been from, like I said, around 2015 all the way up until now.
And nothing's helped you out?
I only had one. I only had one while I was out in Norfolk, Virginia, and he was pretty good, but I ended up coming out here, so I lost contact with him. I also had a massage therapist that was real good out there. So I was doing a correlation of both.
Sure.
And it was helping, but no.
Now you're here. Let's have you look all the way up to the ceiling. Is there any pain when you do that?
Yes.
Okay. Yeah, that's not good. So your face is like this. It's like your eyes are up there, but like you're like.
Yeah, because, because when I do that, I can feel it pulling here, and it's like all the way down my shoulder and my mid back. So.
Let's have you look down too. Does that hurt too?
Not as much.
No. Okay. Look straight. Stand up now for me as well.
All right.
Move forward a little bit.
All right.
And then try and touch your toes.
Oh.
Yeah, does that hurt?
Yeah.
Okay. Come back up.
All right.
That was like a chore to get down there.
Yeah. Yeah.
Let me see you walk. Go all the way down that way.
All right.
Yeah, you're waddling.
Yeah.
What do you feel when you walk?
Right here.
On that
side.
right side? Yeah.
Right side, lower back.
Okay.
Yeah.
Let's have you go. You're gonna lay on your stomach, okay?
All right.
Okay, keep the left leg straight for me, and
Okay.
then lift it up as high as you can go. Ugh.
Okay.
Go back down. Where does that hurt?
Lower back right here.
And then do the right side. Easier or harder?
It's harder.
Yeah, go back down. So we're gonna do some directed breathing, okay?
Okay.
Where I place my hand is where I want you to bring that breath. So like if I place it here, stomach with air. If I place it up here, I want your chest up with air, okay?
Okay.
Independent of each other.
Okay.
Deep breath in right here. Good, exhale all the way out. Deep breath in here and out. Lift the left leg up again. Good. Do the right side. Easier on the right now, yeah?
Yep.
That's kind of like what we were trying to do is just give a more of a level playing field.
Okay.
So before, right, the right side was harder.
Yep.
Right, left side. But this is what's been the real stuck part. Is what's happening here.
Okay.
This right side's been more of compensation than anything. So what we're trying to do is also reconnect certain areas.
Okay.
Once we get to here is where we don't like it, and now this right side can go, but this left side is the tough part. And now it's actually the opposite of what we were seeing at first. So this table's gonna pop up underneath of you, okay?
Okay.
And what I'm doing here is pushing down right where the sacrum is.
Okay.
And pushing it down, because this thing is the one that's kind of turned outwards and in.
Okay.
Yeah, like that. One more over. That's it. And now do the right side up again. How does that feel this time?
Feels good.
Good. Do the right side. Or left side, sorry. Yeah. All right. So what we're also seeing is how your body just kind of responds to different pulls, because we want to see like this nice straightaway that goes from here all the way up to your shoulder. And if it gets stuck, we know that there's something just kind of holding it in. And then one more. There he goes. Now when I do this, your whole body moves with it, which is exactly what we want. Now when I press in here, do you see how much like easier it is for me to press through here?
Right.
Before there was just so much guarding.
It was stiff.
It was stiff, and I was like, I don't know what I'm feeling. In my mind, I'm just giving a clue into what I'm talking about. So when I was pressing in here, like I could feel a few things in through here, but it wasn't clear enough. So we decided to take a lot of that tension out in through here.
Yeah.
But now when we start to press in through here, now it's like a lot easier for me to say, okay, this is where I want to go, this is what I want to do.
Right.
And so the biggest thing that I want to do is go right in through here and right in through there first.
Okay.
Okay. First off, let's have you lay on your back. What do you do for work, man?
So I work for the federal government. I do a little bit of everything. Top secret.
Well, good thing I have a top secret clearance so you can tell me what's going on.
I don't know about that, Tubio.
Once upon a time I did.
Oh, okay.
I was in the army.
Oh.
But nothing crazy.
Hoorah.
Right? It wasn't top secret clearance wasn't that great. Ain't nobody telling me nothing. So we're gonna allow your body just to relax here. So what I want to do is take some of that pressure off into your neck.
Okay.
The biggest thing that I'm noticing is that when you're trying to look up, right, nothing's just moving. So I know that the whole spot It's just compressed because there's just nothing in there. Right? So let's have you relax your head just like that. Okay. Keep your lips and teeth together. Miami. It sounds hot.
Very.
Yeah. At least you got beaches though. We used to live in, me and Ken here used to live in Houston. Same kind of weather.
Oh man. Ooh. Jeez.
How'd that feel?
That felt crazy. It felt crazy, but it felt real good. It felt amazing. I didn't expect that to go all the way down to like my mid back. I felt it from my neck, like all the way down to my mid back. It felt like an accordion.
It's kind of exactly what we were kind of looking for. Especially like, you know, we talk about compression.
Right.
That's exactly why we were talking about that.
Oh, you're a little strong too.
You know, I've been hitting the gym a little bit.
God, man. Yeah, that felt good though. Sure.
Have to go to the gym to adjust, you know, bigger guys like you.
Yeah.
And Ken. How are you feeling? Good?
Yeah.
All right. You ready? Let's have you sit up. All right. 10 chiropractors. That's a lot.
Yeah.
And no relief. Well, except for that one, huh?
Yeah, just the one.
Let's hug. Put your other shoulder above me.
Okay.
Thank you. But I thought you were stiff. Okay. Head back down. There it is. Shoulders relax. Yep. There it is.
Yeah. That's that spot I really couldn't get. Even though I would, like I said, self-crack a lot.
Yeah.
I couldn't get that spot right. Oh, man.
Because normally, like bigger guys like yourself, like they don't have much flexibility.
Yeah.
But I think because you stretch and you try to do all these different things, you know, it's there.
Believe it or not, I was a skinny guy back when I lived in Houston.
Oh, no way. Oh, you lived in Houston?
Yeah, I'm from Houston.
Oh, okay.
Yeah, originally born and raised.
All right. Yeah. Let's have you bend. Keep your body curled like that.
Okay.
Good. Good. Right there. Drop. Oh, yeah.
Oh. 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 Yeah. Yeah.
Probably a tough one for you to get to, huh?
Yeah. Yeah. That felt good, though. That felt good. Okay.
Yeah?
Yep.
Let me sit you up again. 1, 2, 3 up here. How are we doing?
Yeah, good.
Yeah?
But as soon as you touch that right there,
That's where you feel it, right? Yeah.
I can feel it from here all the way. It literally feels like my shoulders like rotated forwards.
That's exactly kind of what it is. So your left, and this is why I was like trying to approach it a couple of different ways. So your left first rib is just like up this way. So I really want to push in this way.
And that's what the massage therapist was telling me. She was saying, "Oh, you got a rib that's out of place." No? But I didn't really know what that meant. Like a rib out of place.
That's just something that's up there, right?
Right.
Let's have you turn and face the wall that way. So we're right here. Lean back on me. I don't like you, right? I know it's probably not the most, not the best feeling. So we're just opening to see where that first rib. And as soon as we get to like right there, we can feel that. And I know you can feel that too. I'm gonna drop and easier on that shoulder more. Good. Oh, yeah.
I know she's queasy about that one.
Yeah, but now when I press in through here, how's that feel?
Yeah.
Easier, yeah?
Yeah, way easier. And when I watch her videos all the time, she says, I don't see how you can just sit and watch that. And the way that he, just cracks people, and it's just like, ew. I'm like, I enjoy it because I can just feel myself in their position. Because, man.
Hey, you do a pretty good impression, huh?
She hates it.
Let's have you turn your legs face the windows that way. We're gonna see if we can open the shoulder up like this. So go slow with me because I gotta make sure like this block is in the right place. That's great. Yeah. We're gonna get off that shoulder blade. Ooh. Wow. All right, yeah, that was it.
Yo, what? Oh man. And the last chiropractor tried to do that, literally, and he couldn't do it. Wow.
He didn't have enough depth. That's probably what happened.
Wow. Because I would get tingling down my elbow, from my shoulder to my elbow. My pinky now it feels warm.
I call it poop tingles. You know, you sit on the toilet for too long.
Yeah, most definitely. What? Oh, okay.
Yeah, that shoulder really felt like it was like shifted forward like this.
Yeah.
Most of the times whenever I adjust shoulders, I'll try and adjust the first rib first.
Yeah.
And that's kind of what we had to do with you. Okay. Just because like there was just so much guarding and so much tension.
Yeah.
So if I try to put you in that position and then elevate it even more, it sucks.
Yeah.
You know?
Yeah.
Let's have you turn and face this way now for me. That was loud and gross at the same time.
That's been my biggest issue, man. I can't bench press. I can't do any lateral raises. I can't do anything. Every time I try, it gives me like that popping and clicking. And even when I'm sitting up, when I'm at work or I'm at the desk, it literally feels like my lat is like protruding on my back because it feels like it's just rotating.
Yeah, it honestly felt like because this shoulder was coming forward this way, the ribs back here were protruding outwards, and then the mid back was getting stuck as well too. That's why like the first one we did was right in through here, and I knew I needed to get that. That's why we used a different block. That's why it was a little painful, honestly.
Yeah, most definitely. But
yeah. How's your headache so far?
I can feel it like subsiding. It's not even how it was earlier. It was almost beaten earlier.
So one of the biggest things, let me see this. We're gonna go down to the right side. You see how like you can go far this way?
Yeah.
But this side you're gonna get caught right there. Feel that?
Yep.
Okay. So you get caught right there because your atlas is like shifted so far hard to this left side. So you're at 30 millimeters compared to this 25. That's a lot, honestly. So it should be more even than anything. It's probably also disjointing that occiput as well too. But what I'm feeling more than anything is that atlas. So we're gonna adjust this atlas. We'll also adjust the occiput if it feels like we still need it.
Okay.
But we'll see. We like to take it one at a time, you know what I mean?
Yeah.
So your atlas is also just a little anterior. So we're gonna have you tilt like that. Okay. Here, we're gonna bend in. Good. Drop your head a little bit. Not just let it fall. Like let it fall down. Ooh. Wow.
I felt that in my jaw.
Yeah.
Yeah. Oh yeah. I'm gonna sleep good tonight. For sure. Yeah.
Yeah, now when we press, it's different. For sure. Yeah, that occiput's still there. That's all right, we'll go for that occiput now. Do this like this. Head this way. Let's see. 1, 2, 2. Okay. Lean on my leg, trust me. All right. So right in through here, his occiput's just kind of jammed. So we're actually gonna go a little bit lower, C5, but also grabbing this occiput as well too, to kind of take it with us. Good. Drop your head a little bit more here. Oh, wow.
What? Did you hear that?
Did I?
Yo. Wow. Ooh. Like the room is like colors. Yeah. Oh man. Okay. Yeah.
Yeah, right?
Yeah. That's it right there. That was it. That was the spot that I always complained about right there. Literally. And as much as I try to like adjust it myself, I could never get like right in there. Never. Yeah.
I'm gonna let you enjoy that one, man. I'm enjoying that one too, just because of like what we were able to do with you.
Yeah.
That was great.
Yeah. Yeah. Most definitely. And my jaw doesn't even feel tight over here no more. Because usually when I would open my mouth, it would kind of feel tight. It's I don't feel that no more. Wow.
So good.
Okay. Yeah.
Like, we're all right.
Yeah.
We're all right.
Listen, if I still stayed in San Diego, I'll be up here every week. I'm telling you. What? Man.
Well, if you ever move back to San Diego, right, you could always come back.
You know,
Or, you could always go to Houston. My guy's in Houston there too, so.
I don't know about home, but she loves San Diego. This is her first time in San Diego, so.
It's nice, isn't it?
Yeah. It's the sunshine touch.
The sunshine, yeah, Let's have you lay on your side. You're gonna face the wall to this way, yep. Good, easier on that shoulder. Let's come down that way, yeah. That's it right there. Good. Let's have you roll a little bit down towards me there. Oh, wow. Beautiful.
That was all that walking you did that right there. Yep. Oh my God. Oh.
Let me give you a minute. That was.
Ooh. That was all that walking yesterday on Mission Beach. Yep. I knew it. I said, I'm gonna save that for him. I'm not even gonna touch it.
That wasn't even just like a good crack. That was like a deep.
Yeah.
Like,
that was definitely. Yeah, because my biggest issue is when I tore my left ACL, I would compensate a lot on my right side, like standing, walking, because it just, they say once you get it repaired, it's never the same. And I kind of feel like that with my left. So I have a lot of pressure here on my right side just by compensating. And that right there just like.
Open it up, yeah.
Yeah.
Heck yeah. The first thing that I was doing, so your left sacrum is like popped out like this. So that's the first thing I was pushing down, and that showed that change. But we do that to like, that can be an adjustment in itself.
Right.
But I also like to get that osseous adjustment in there too, because we needed to.
Yeah.
All right. Because you're also like you do a lot of workout, like working out, and you were an athlete before or now, I'm not going to cut you short, right? When a person's body is like that, it needs a little bit more help.
Yeah,
for sure.
Most definitely.
Lay on this side now for me
Yes, sir.
too. Okay, so this one's a little different. We're having to pull this upwards, but we're waiting for it to unlock, which is right there. New York, huh? We're going to New York in December, which is awesome.
Oh. Oh my God. Oh.
That was just a little sidebar talk. But we are though. I'm excited. I actually was born in Jersey.
I always thought you were from Houston.
No, we lived there for about 7 years. But I was born in New Jersey and then spent actually most of my life in Pittsburgh.
Oh, okay.
Which was, Pittsburgh. Good city, don't get me wrong. A little lacking in the diversity, which,
Yeah.
it is what it is. But it's, I have an 11-month-old son right now, and this is just like total sidebar talk. One of my biggest things is I love diversity because I feel like I can't just have all Asian people out at once, right? Because that's not the world. But whenever I was in Pittsburgh, like everybody was white, so it was different. And what was crazy is that I was talking to some of my friends, like we went out to dinner, and they're from California. And I'm just talking about like, I experienced a lot of racism when I was a kid. Like that's just kind of what it was. And they're like, really? I was like, that's never happened to me. And I'm like, well, that's nice. But you know what? At the same time, it's kind of nice
Right.
that they weren't able to. And then, that kind of stuff is looked down upon. Where I grew up, it was just very common. And, it was hard for me to date. It just kind of got into everything, like hard to date, like even jobs and stuff like that. And I was only a kid too. So, you don't really truly understand the whole concept of it and how messed up it is.
Right.
But that's why, like, my kid, like, I just want him to grow up around everybody. Like, I want my kid to be like this,
Right.
and to grow up around like a whole diverse amount of people, like not just be stuck with one thing.
Right.
You know, actually there was an older couple, and I said that, and the guy was in the chair, and he was like, well, that wouldn't be the worst thing in the world, you know? Hands up on your chest a little bit more, and out. Do that. A little bit more.
Oh my God. Oh my God. He's really strong. Oh my God. I may be an inch and a half tall after that. Yo. I felt that all the way down on my tailbone.
Good. That's how we know we unwinded a lot of those things in that lower back, right? Because if you can't always feel it down there, that means that there's like a blockage still.
Even in my hip, I can feel it, like the blood flow.
Yeah.
It's crazy. Ooh, well worth it. Oh man.
You plan on walking a lot today?
No, I'm gonna relish in this moment.
No Disneyland for you, huh?
No.
Here.
Oh
Wow. That was nice too.
yeah.
So what we're doing is adjusting navicular. This is the talus one here first. Talus happens whenever there's like so much pressure on here. It can happen because of the feet, because of the shoes really. Just so much pressure right in through there.
Yeah.
Oh my gosh. That was a little bit more than I thought it was going to be. And then a little higher. There it is. Good.
Yeah.
Let's see this too. Yeah, okay. Good. Sit up for me, man.
All right.
Let's check you out again. Turn your head to the right. It's 100%, bro.
Oh, I can see her now.
Watch out. Look to the left.
All the way.
Yeah.
Man.
Improves. Look all the way up for me. Heck yeah, that improved. That's a lot.
Yeah.
You were like pancaked. I don't know.
All right.
Look
I
all
was
the way
raggedy.
down. Yeah. Any pain when you're doing those?
No.
Good.
Not at all.
Stand up for me too.
Yeah.
Let's try and touch your toes for me.
Oh God.
Oh.
What? Man, that is crazy. I haven't felt this in years. Years, man. Literally. Wow.
So good.
Yeah, I
You
feel
want to see if you still waddle? Nah, you ain't waddling anymore. There's no waddling there.
No, not at all. Wow. That's crazy. Okay. Yeah. I always knew with the online reviews and what everybody said he was the truth. Yeah, I've been blessed by Dr. Tubio. Appreciate it. I really appreciate it, for real.
Yeah.
Most definitely.
Appreciate you, man, for sure. What are you feeling now, like compared to when you first walked in?
So
what changes?
initially when I walked in, shoulder, it really, like I felt tension from here to here, all the way up my neck. Don't feel that anymore. Lower back was really, really tense. Don't feel that anymore.
Let's go.
At all. Like nothing. Right hip to nothing. Everything is.
Heck yeah, dude.
I feel like I want to go hit the gym real quick. Test the shoulder up. Yeah, I feel good though.
Good, man.
I feel really good. I really appreciate it.
Yeah, dude.
Well worth it. So.
Well, I appreciate you. There's gonna be two things that I want you to get from us here before you go. The neck block is a huge thing because we need to restore curvatures. So I'm all about making sure that your body is continuing to do better, right?
Yeah.
Your body's been in a pattern for a lot of years.
Okay.
So this is what your neck looks like. Like you got no curve. In fact, it's like the opposite way. And ideally that curve's supposed to look like this.
Yeah.
Okay. See that difference?
Wow.
Yeah. So that neck block, all you do with it is lay on it for about 20 minutes every single day.
Okay.
Those curves will eventually start to return. And as it starts to return, you'll see the headaches not come every day anymore as well too. You just have to do it every day.
Yeah.
Instead of you just doing this because that's not really doing much.
Right.
And then the middle back block for you as well. I think your shoulder has had so much like this anterior forward carriage
Yeah.
that what it wants to do is like your muscles are still like, what the heck do I need to do? So that middle back block, you're gonna lay on it, let your chest expand continuously,
Okay.
right? If you're doing top secret stuff, you probably are sitting down a lot as well too. So you need to get that to open up even more so. So the better head mobility, like better neck curve you have, the better your shoulder health is. The more mobility you have in your thoracic spine, the more mobility you have in your shoulders.
Okay.
So you'll see this. Like right now, your muscles aren't conditioned to this. As they get conditioned, like if you go work out and it's hard, you'll start to feel a little bit of a throb. Lay on that thing, it'll start to pull your shoulders back.
Okay.
It's just basically your body's trying to get back to its original position, and it just needs some help because your curves aren't helping it.
Okay.
All right.
Cool.
But cool, man.
Yes,
You're
sir.
all set with me.
I appreciate it.
Yeah, brother.
Yes, sir. Yes, sir. I appreciate it.